Hi everyone, my name is Kathy Ton and I'm currently a first year pharmacy resident at the University of California, Davis Medical Center. It is my pleasure to be giving this lecture today on HIV pharmacology. Before I get started and dive in too deep, I wanted to provide an overview of how this lecture is going to be given. This lecture is broken down into 3 different videos. In the first video, I'm just going to be providing a little bit of background on what it takes to become a pharmacist, what clinical pharmacists do, and share with you a little bit of how I got to where I am today. In the second video, I will be reviewing HIV pathophysiology, or the process of HIV infection, transmission, prevention, as well as some mutations and resistance, some interesting things that I would like to share with you about that topic. And finally, in the third video, I'll be spending some time discussing the pharmacology of the actual agents that are FDA approved for the treatment of HIV. Here are the objectives for this lecture. By the end of this lecture, I would like you all to be able to review the pathophysiology of HIV infection, discuss the HIV life cycle, and understand how each of the classes of medications or antiretroviral agents target specific steps of HIV viral replication. I would like you to understand the mechanisms for developing antiretroviral resistance. And lastly, I'd like you to be able to recall which agents are used together to make a full antiretroviral regimen. So the word antiretroviral is quite the mouthful, so from this point forward, I will be referring to them as ARVs. So your instructors have shared with me that many of you are finishing up your final years of undergraduate education. I just want to say congratulations, and I hope that some of the information that I share with you about pharmacy and the field of pharmacy will help to either inspire you, solidify your career goals, or help you to get thinking about your next steps after undergrad. So to dive right in, what exactly is pharmacy? And what exactly does a pharmacist do? And what can you possibly do with a degree in pharmacy? Well, for starters, pharmacists can do a lot of things. You can get a degree in pharmacy or a doctor of pharmacy degree and become a pharmacist in a community setting, which is what I'm sure many people are familiar with. So this is becoming a pharmacist that works at a CVS or a Walgreens or a Rite Aid. There you're responsible for dispensing medications and filling prescriptions that come in from doctors' offices, answering questions about medications, and providing education to patients on proper use and administration of their medications. You can get a doctor of pharmacy and also become a clinical pharmacist that works for a drug company, or you can work as work in academia and become a clinical professor and an associate professor at a local college of pharmacy. What I'm trying to do and the path that I'm taking is towards becoming a clinical pharmacist. Clinical pharmacists actually have a lot of very cool responsibilities. So one of the privileges of becoming a clinical pharmacist is that you're able to work alongside a lot of providers and in collaboration with physicians and nurse practitioners and other healthcare providers in order to determine the most appropriate and efficacious therapy there is for a patient. Clinical pharmacists can be found in multiple settings, such as hospitals or ambulatory care settings. And although they're working with medications, they kind of deal with a lot of different things. So as a pharmacist that's in an ambulatory care setting, for example, we are helping to manage a lot of chronic disease states, which include diabetes, high blood pressure, or high cholesterol, and we're making sure that those medications are continuing to work in our patients, monitoring for any side effects, and making sure that they're staying adherent or taking their medications appropriately before any discontinuation or considering additional therapies. In a hospital setting, a lot of patients are maybe more acutely ill, so you're spending a lot of time looking over their medications and seeing what changes can be made on a day-to-day basis as a patient is either getting more sick or recovering from their illness for reasons why they're in the hospital. So you can become a general clinical pharmacist, or some people will go on to do further training to specialize in a specific area. So you can be a cardiology trained clinical pharmacist, which generally will require a little bit more training and a little bit postgraduate training, which is something I can talk about on the next slide. And so on this slide here, I've provided a basic overview of generally what it takes to become a pharmacist or a clinical pharmacist. So on average, after high school, it takes about 10 years to become a clinical pharmacist, or about 6 years after graduating from college or undergrad. So first you have your bachelor's degree, which you are all currently getting. I attended the University of California, Riverside, where I got my Bachelor's of Science in Biochemistry. So while I was pursuing my undergraduate degree, I was also fulfilling a lot of the prerequisite classes required for pharmacy school. So it's nice if you are currently in the field of science, because a lot of those prerequisites are required for you to obtain your degree, so they will align and you don't have to take extra classes. But if you know that you want to go to pharmacy school, I would highly encourage that you do your research ahead of time, because not all pharmacy schools are created equal. A lot of the classes and the requirements for programs will vary, and so it'd be good to know what you're interested in, where you're going, so you can make sure you can plan accordingly. So aside from the prerequisite classes that you need to take, some schools will also require that you take a pharmacy school entrance exam, or the PCAT. The PCAT includes topics such as biology, chemistry, biochemistry, some anatomy and physiology, organic chemistry, and some calculus and even physics. And so it's always good to prepare for the exam and make sure that you're giving yourself sufficient time to do so. A lot of people will do this maybe during their junior or senior year, as they're kind of wrapping up a lot of their science courses, so that that information is still fresh in their brain. Or if you're anyone like me, I took a year off in between undergrad to kind of study for my exam, as well as, work a little bit more so I can gain experience in the field of pharmacy before I applied. So once you apply for pharmacy school, it can be anywhere from another 3 to 4 years after your undergraduate education. Some universities that have a pharmacy school in California include UCSF, UCSD, and USC or UOP. For me, I actually went to another state to attend pharmacy school, so I attended Washington State University in the state of Washington, so Washington State. Pharmacy school is actually a little bit different than undergrad. There are various class sizes, so you might notice that your class sizes will maybe shrink compared to, these big lecture halls that you're in. For me, my pharmacy class itself was only 100 people. So you will get to know some of your classmates a little bit better than you do now. And unlike undergraduate, you don't actually get to pick your classes. Your schedule is basically planned out for you. And a lot of the schools will kind of structure their didactic courses and their pharmacy experiences the same, where your first 2 or 3 years of pharmacy school will be mostly didactic, so you're spending a lot of time in the classroom and in the laboratory. And then your last year, your third or fourth year of pharmacy school, you're spending that out on the field. So going in and working in different environments and kind of teasing out what you do and don't like, so that you're able to pick a career path that's best for you. So generally during the first year of pharmacy school, they'll give you a white coat, and then you'll learn about a lot of the basic sciences, so basic disease states, introduction to pharmacology, and learning different skills like measuring blood pressure or testing point of care blood sugars, and then taking some additional biochem and physiology courses as well. Going into your second and third year, you apply those basic concepts that you learned in your first year and use that knowledge to learn how to treat certain disease states with medications and learn how different disease states affect how medications work. For example, during your first year, you might learn how the heart works through physiology. And then in your second and third year, you're learning about all the different disease states and how to use medications to treat those disease states that do affect the heart, like maybe a heart attack. Then finally, during your fourth year, they set you free into hospitals, clinics, and even community pharmacies in order for you to gain experience. During this time, you're practicing as a pharmacy intern. However, it's important to note that you are not yet a licensed pharmacist. You are actually practicing under a licensed pharmacist who is your preceptor. So during this time, you're observing these pharmacists or even shadowing them, and depending on how comfortable they are with your knowledge and how far along you are in your clinical rotations, they might have you even help to treat patients. But remember, you aren't licensed yet, so none of your recommendations or your treatment suggestions should be recommended or implemented without running them by your preceptor first. During this year, you also are applying for residencies if you know that you want to pursue further training after you are done with pharmacy school. During your fourth year is also when you have to apply for residency. Usually people will apply to about 15 different programs on average, and you're scrambling to find letters of recommendations, preparing your packet for submission for interviews, as well as preparing for interviews. Interviews are generally anywhere between 8 to 12 hours long because a residency program really wants to see who you are before they just let you in. This is also a good time for you to interview them to make sure that the program has what you need in order to succeed and to pursue what you want to do in your pharmacy career. Then on match day, which is generally in March, you find out where everyone matched for residency. And then that's where you'll spend the next 1 or 2 years of your career after you're done with pharmacy school. Then after you're done with all your clinical rotations of your fourth year, you finally finish pharmacy school and you finally get to graduate. You're a doctor of pharmacy and you finally get to put the word doctor in front of your name. But that party doesn't last long because you'll be spending your summer preparing for your board exam and your state license exam. So what does it really mean to be a resident? Life is not much different as a resident than it is from being a fourth year student, besides the fact that you are licensed. When you are a resident, you're fulfilling a lot of different roles and wearing a lot of different hats. First of all, you're primarily reporting to a preceptor or a practicing pharmacist who is teaching and mentoring and supervising you as a resident. When you become licensed and maybe you're more comfortable practicing independently, then you too can become a preceptor for pharmacy students that are practicing in your area. We're also responsible for staffing, which means we fill in as the primary pharmacist on a particular service or in a particular clinic. For example, for my program, I have a lot of co-residents, so we rotate every fourth weekend staffing the anticoagulation clinic or even the clinic that I currently work in, One Community Health, as the primary pharmacist. We also have our on-call responsibilities, which includes carrying a pager, which we can get paged for specialty medication questions or anticoagulation questions. We'll carry this pager generally overnight for 1 day a week and sometimes even over the weekend. We are also responsible for an evening pharmacist shift where we're taking care of a lot of different patients in the hospital setting, either managing their antibiotic dose, verifying orders, or going to codes. But the bulk of what we do as a resident is going through all the different clinical rotations. Like I said, being a resident is very similar to your fourth year clinical rotations. However, you are now licensed as a resident. This means you are expected to and able to practice independently. However, your preceptor in that practice area is still available to help you answer any questions and to guide you through any difficult cases that you may not understand. That's the beauty of being a resident. You're able to learn and still essentially mess up with someone there to still catch you. So, what do pharmacists do to care for patients living with HIV? Well, first off, we're constantly screening patients and making sure that they're taking their medications correctly. If they are not taking their medications correctly, it would warrant further investigation to see if there is a reason that we would need to change their medications or to provide education for them to understand why it's important for them to take their medications every single day as prescribed. As you'll learn in our later discussions, that strict adherence to medications is very important in HIV, especially since the patients have to be on these medications lifelong. We're also always looking for drug-drug interactions. Although a lot of medications are efficacious and safe when taken on their own, they might interact with other drugs that patients also need to be on long-term for other disease states. Really important that we're looking for these interactions to make sure that all therapy remains efficacious and that a patient is not being harmed as a result of taking multiple medications together. Thirdly, we're also constantly screening for side effects and asking patients whether or not they're experiencing side effects with their medications. The reason why this is important is because, like I said, HIV is a chronic disease state. Patients who have HIV will be on medications lifelong, and so we want to make sure that they're tolerating their medications appropriately so they can continue to remain adherent, which takes us back to step 1. Furthermore, we're also addressing their other primary care needs. Luckily for us as pharmacists in California, we're able to work under CPAs, also known as collaborative practice agreements. These give us the ability to adjust, monitor, and initiate therapy for different disease states, including hypertension or high blood pressure, hyperlipidemia or high cholesterol, diabetes or high blood sugar, hepatitis C, which is another viral infection in which a lot of HIV patients are commonly co-infected with, pain management, as well as anticoagulation, or monitoring of patients that are on blood thinning medications. And where are we headed? Earlier this year, California passed a law to allow pharmacists to provide HIV preventative medications without a prescription from a provider. So historically, pharmacists do require prescriptions be written by a practitioner, which means a doctor or a nurse practitioner, in order for them to dispense a medication. However, this new legislation allows for pharmacists to independently practice their clinical skills to determine whether or not a patient is appropriate to be on PrEP, or pre-exposure prophylaxis, or PEP, post-exposure prophylaxis. Not only will this enhance the role of the pharmacist, but this will help to reduce the spread of HIV.